Hi, I'm Sarah Bernstein. I'm a clinical nurse specialist in gynecologic oncology, and I'm here to talk to you about some of the side effects or some of the things that you need to know in getting ready for your chemotherapy. So we're going to talk about venous access devices, and this is where we're talking about what is a port. So the pictures that I'm showing you here show you what the port looks like. And I also have for you, just to kind of give you an idea of the size of how big these are. This is a venous access device. It would be placed in the chest, under the collarbone, on either the right or the left side. Generally, this is done in interventional radiology, and sometimes our oncologists can also be the surgeon to place those. And as you can see by the picture, they're pretty small. The biggest point of it is not much bigger than the size of a nickel. So what can we use a port for? I can use it to draw blood. I can give you just about anything through any normal IV. So IV fluids, medications, blood, platelets, all of those things. These are all now called power ports. So we can actually use these for CT scans, PET scans, and MRIs, as long as they're accessed with the correct needle by your IV nurse. So anything you can use a central line for, I can use a port for. They're about the size of a nickel, placed under the skin in the chest, or it also can be placed in the upper arm under the skin here. This one's called a passport, but it's exactly the same. It just has a little bit longer tubing. We use a special kind of needle. It's called a Huber needle, and only nurses that have been trained and have a competency in accessing your port are the ones who are going to be actually accessing your port for you. So basically, this is just a large IV that goes into the vein, that goes to your heart, but it doesn't actually go into your heart. So why do I need to get one? Well, some of our chemotherapies have longer infusion times, so it's real important that we have a safe and effective venous access available at all times during that infusion. So some of our infusions can go for several hours, and I need a really good IV for that. Sometimes your veins aren't the greatest. So ask yourself, how many times did they stick me while I was in the hospital? If you had multiple sticks, it's not unusual that maybe your veins are kind of tired even now. So using a central line would be very helpful. It's going to make your experience much safer, and it'll also expedite all of your care, because we know we can just go ahead and get your blood and get you going. And patients tolerate it extremely well. So what are the drawbacks of having a port? Well, there are two. One is, if your counts get very low and you develop an infection, this is potentially one place that an infection could occur. And then the other piece is that sometimes patients with a central line can develop a small blood clot. So while the incidence of this is on the low side, your nurses and your doctor will be keeping a close eye on your port to make sure that there aren't any complications. But again, only those nurses who have done their competency in accessing the port will be the ones using that port. So how long do I need to keep it? Well, the final decision of when your port is removed is between you and your oncologist. In general, we ask that you keep this port for about 6 months after your therapy is completed, so that you'll have it available for blood draws, for any CT scans, anything else that you might need it for. And while the port's in place, it needs to be flushed about every 4 to 6 weeks when you're not receiving your therapy. So, in summary of everything we've talked about, I want you to be real proactive and be proud of yourself. This is not an easy journey. Use your team, those you know, and those who can give you advice. People have been down this road before, but your team has been there and they understand you. Take care of yourself and don't try to do everything. You know, we tend to do everything and don't want to ask others for help. And sometimes that's the hardest thing to do, is let others do things for you. Know your limitations, and then surround yourself with some positivity. This is going to be a long road. So keeping those around you that are positive and keeping you forward will help you in that long road. So thank you very much, and best of luck in this long journey.